What is the maximum beyond use date, BUD, for a non-sterile compound prepared with water and stored in the refrigerator? A. 7 days. B. 14 days. C. 30 days. D. 90 days. Answer, B. According to USP less than 795, a water-containing oral formulation should not exceed 14 days when stored at controlled cold temperatures. Which of the following medications requires a Risk Evaluation and Mitigation Strategy, REMS, program? A. Isotretinoin. B. Atorvastatin. C. Hydrochlorothiazide. D. Omeprazole. Answer, A. Isotretinoin is associated with severe birth defects and is regulated through the iPLEDGE REMS program to prevent fetal exposure. A technician receives a prescription for metoprolol tartrate. What is the therapeutic class of this medication? A. Anticoagulant. B. ACE inhibitor. C. Calcium channel blocker. D. Beta blocker. Answer, D. Metoprolol tartrate is a beta blocker used to treat high blood pressure and other cardiovascular conditions. Which of the following dosage forms bypasses the first-pass metabolism? A. Oral tablet. B. Suspension. C. Sublingual tablet. D. Capsule. Answer, C. Sublingual administration allows the drug to be absorbed directly into the bloodstream, bypassing hepatic first-pass metabolism. What does the DAW1 code indicate on a prescription? A. Generic substitution permitted. B. Substitution not allowed by prescriber. C. Patient-requested brand. D. Pharmacist-recommended brand. Answer, B. DAW1 means the prescriber has specifically requested that the brand name product be dispensed with no substitution. What is the proper technique to clean a horizontal laminar airflow hood? A. Back to front, top to bottom. B. Circular motion, random pattern. C. Front to back, side to side. D. Top to bottom, back to front. Answer, D. Cleaning should be done from cleanest to dirtiest, top to bottom, back to front, to avoid contamination. Which federal agency regulates the labeling of prescription medications? A. CDC. B. FDA. C. DEA. D. OSHA. Answer, B. The Food and Drug Administration, FDA, is responsible for ensuring that prescription drug labels are accurate and safe. Which of the following medications must be stored in its original container to prevent photodegradation? A. Nitroglycerin. B. Lisinopril. C. Metformin. D. Simvastatin. Answer, A. Nitroglycerin is sensitive to light and moisture and must be stored in its original amber glass container. What is the generic name for Zyprexa? A. Risperidone. B. Olanzapine. C. Quetiapine. D. Aripiprazole. Answer, B. Zyprexa is the brand name for olanzapine, an antipsychotic medication used to treat schizophrenia and bipolar disorder. Which organization assigns national drug codes, NDC? A. DEA. B. NABP. C. FDA. D. ASHP. Answer, C. The FDA assigns and maintains NDC numbers used to identify medications. A pharmacy receives a partial C2 order. The supplier must provide the remaining balance within A. 24 hours. B. 7 days. C. 30 days. D. 60 days. Answer, D. Under DA regulations, the supplier has 60 days to fulfill the balance of a Schedule II partial order. What is the storage requirement for most reconstituted oral antibiotics? A. Room temperature only. B. Freezer. C. Refrigerator. D. Heated cabinet. Answer: C. Most reconstituted oral antibiotics must be refrigerated to maintain stability and effectiveness. What schedule is tramadol classified as under federal law? A. C2. B. C3. C. C4. D. CV. Answer: C. Tramadol is classified as a Schedule IV controlled substance due to its abuse potential. What is the purpose of MedWatch? A. To report workplace safety violations. B. To report adverse drug events. C. To track DA numbers. D. To renew technician licenses. Answer: B. MedWatch is the FDA system for reporting adverse events, medication errors, and product quality problems. What is the definition of a therapeutic equivalent drug? A. Same shape and color. B. Same price. C. Same active ingredient, strength, dosage form, and route. D. Same manufacturer. Answer: C. Therapeutic equivalents have the same clinical effect and safety profile when administered to patients under the conditions specified. Which auxiliary label should be used for a metronidazole prescription? A. Do not take with alcohol. B. Take with grapefruit juice. C. May cause drowsiness. D. Refrigerate. Answer: A. Alcohol should be avoided with metronidazole due to the risk of a disulfiram-like reaction. What does the suffix sartan typically indicate? A. Antibiotic. B. Beta blocker. C. ARB, angiotensin II receptor blocker. D. Diuretic. Answer: C. The suffix sartan denotes ARBs, commonly used to manage hypertension. A Class 3 recall involves: A. Serious health consequences. B. Temporary health issues. C. Controlled substances. D. No significant risk to health. Answer: D. Class 3 recalls are for products that are unlikely to cause adverse health consequences. Which law mandates patient confidentiality in pharmacy practice? A. OBRA 90. B. HIPAA. C. CSA. D. PPPA. Answer: B. HIPAA protects patient health information and ensures confidentiality across healthcare settings. How many refills are allowed on a Schedule III controlled substance prescription? A. None. B. 3 refills in 30 days. C. 5 refills within 6 months. D. Unlimited for 1 year. Answer: C. Schedule III prescriptions may be refilled up to 5 times within 6 months from the date written. Which of the following is a high-alert medication that requires extra precautions during dispensing? A. Simvastatin. B. Insulin. C. Loratadine. D. Acetaminophen. Answer: B. Insulin is considered high alert due to the risk of severe hypoglycemia if dosed incorrectly. Which medication requires the technician to calculate body surface area, BSA, for proper dosing? A. Levothyroxine. B. Methotrexate. C. Etoposide. D. Lisinopril. Answer: C. Many chemotherapy drugs, including etoposide, are dosed based on BSA to ensure accurate and safe dosing. What is the appropriate action if a prescription is written for zolpidem 50 mg? A. Fill as written. B. Call prescriber to clarify. C. Change to 5 mg. D. Reject the prescription. Answer B. Zolpidem is not commercially available in a 50 mg strength. The pharmacist or technician must clarify the dose with the prescriber. What is a common side effect of ACE inhibitors like enalapril? A. Weight gain. B. Insomnia. C. Persistent dry cough. D. Constipation. Answer C. ACE inhibitors commonly cause a dry cough due to increased bradykinin levels. Which form is used to order Schedule II drugs? A. DA Form 222. B. DA Form 106. C. FDA Form 483. D. DA Form 41. Answer A. DA Form 222 is required for ordering Schedule II controlled substances. What is the correct beyond use date, BUD, for a non-sterile aqueous oral suspension prepared without preservatives? A. 30 days. B. 7 days. C. 14 days. D. 60 days. Answer C. For non-sterile aqueous oral preparations without preservatives, USP less than 795 recommends a maximum BUD of 14 days when stored in the refrigerator. Which of the following is a high-alert medication according to ISMP? A. Loratadine. B. Insulin. C. Acetaminophen. D. Amoxicillin. Answer B. Insulin is considered a high-alert medication because errors in its use can result in significant harm or death due to hypoglycemia. What is the primary function of a laminar flow hood in pharmacy compounding? A. Labeling prescriptions. B. Ensuring aseptic technique. C. Counting tablets. D. Maintaining refrigeration. Answer B. A laminar flow hood provides a sterile environment by using HEPA-filtered air to maintain aseptic conditions for compounding sterile preparations. What auxiliary label should be placed on a prescription for tetracycline? A. May cause drowsiness. B. Take with antacids. C. Avoid sunlight. D. Shake well before use. Answer C. Tetracycline can cause photosensitivity, so patients should be warned to avoid excessive exposure to sunlight or use sun protection. A patient is prescribed levothyroxine. When is the best time to take this medication? A. With dinner. B. Before bedtime. C. With breakfast. D. On an empty stomach in the morning. Answer D. Levothyroxine is best absorbed on an empty stomach, typically 30 to 60 minutes before breakfast for optimal effectiveness. According to the DA, what is the maximum number of refills allowed for a Schedule III drug? A. None. B. 1. C. 5. D. Unlimited within 1 year. Answer C. Schedule III and IV drugs may be refilled up to 5 times within 6 months from the date of issuance, per DA regulations. Which drug class does lisinopril belong to? A. Beta blockers. B. ACE inhibitors. C. Calcium channel blockers. D. Diuretics. Answer B. Lisinopril is an angiotensin-converting enzyme ACE inhibitor used primarily to treat high blood pressure and heart failure. Which of the following medications must be dispensed in its original container due to sensitivity to moisture? A. Nitroglycerin. B. Metformin. C. Warfarin. D. Simvastatin. Answer A. Nitroglycerin tablets are sensitive to light and moisture and must be dispensed in the manufacturer's original glass container. How many ml are in a half-pint bottle of cough syrup? A. 120 milliliters. B. 240 milliliters. C. 473 milliliters. D. 500 milliliters. Answer, B. 1 pint equals 480 milliliters, therefore, 1/2 pint equals 240 milliliters. The Red Book is primarily used in a pharmacy to find information on A. Drug interactions. B. Therapeutic equivalence. C. Pricing and product availability. D. Sterile compounding guidelines. Answer, C. The Red Book provides information on drug pricing, NDC numbers, and product availability, used mainly for reimbursement and insurance purposes. What is the appropriate action if a technician discovers expired medications on the shelf? A. Place them back on the shelf. B. Dispense them only if stock is low. C. Notify the pharmacist and quarantine the stock. D. Dispose of them in regular trash. Answer, C. Expired medications must be reported to the pharmacist and segregated from active inventory for proper disposal or return. Which of the following medications requires a medication guide to be dispensed? A. Diphenhydramine. B. Metformin. C. Albuterol. D. Isotretinoin. Answer, D. Isotretinoin requires a medication guide due to its high risk of teratogenicity and other severe side effects. A pharmacy receives a prescription for 180 milliliters of a liquid medication. How many tablespoons will the patient receive? A. 9. B. 12. C. 18. D. 36. Answer, C. 1 tablespoon equals 15 milliliters. 180 divided by 15 is equal to 12 tablespoons. Which act mandates that pharmacists offer counseling to Medicaid patients? A. Controlled Substances Act. B. OBRA 90. C. Durham-Humphrey Amendment. D. Kefauver-Harris Amendment. Answer, B. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, requires pharmacists to offer counseling to Medicaid patients regarding their prescriptions. A patient asks if they can split their enteric-coated tablet. What should the technician do? A. Confirm it's okay and split it. B. Recommend crushing the tablet. C. Refer the question to the pharmacist. D. Use a pill cutter. Answer, C. Enteric-coated tablets are designed to dissolve in the intestine. Splitting may compromise this protection, so only a pharmacist should address the question. Which of the following DA forms is used to order Schedule II medications? A. DA Form 222. B. DA Form 41. C. DA Form 106. D. DA Form 224. Answer, A. DA Form 222 is required for ordering, transferring, or returning Schedule II controlled substances. What is the term for a pharmacy's detailed plan for managing hazardous drugs? A. Prescription protocol. B. SDS plan. C. Hazardous drug control plan. D. USP Chapter less than 800 compliance plan. Answer, D. USP less than 800 outlines standards for the safe handling of hazardous drugs in healthcare settings, including pharmacy settings. How many grams are in 2.5 kilograms? A. 25. B. 250. C. 2,500. D. 25,000. Answer, C. 1 kilogram equals 1,000 grams. Therefore, 2.5 times 1,000 is equal to 2,500 grams. Which medication below is most likely to cause gingival hyperplasia? A. Phenytoin. B. Amoxicillin. C. Metoprolol. D. Prednisone. Answer A. Phenytoin, an anti-seizure medication, is known to cause gum overgrowth, gingival hyperplasia, as a side effect. A prescription is written for amoxicillin 250 mg per 5 ml, 1 teaspoon TID times 10 days. How many ml are needed? A. 50 ml. B. 100 ml. C. 150 ml. D. 200 ml. Answer C. 1 teaspoon equals 5 ml, TID equals 3 doses/day, for 10 days equals 30 doses. 30 by 5 ml equals 150 ml. Which term refers to the process of destroying microorganisms on surfaces? A. Disinfection. B. Sterilization. C. Asepsis. D. Deactivation. Answer A. Disinfection removes or kills most microorganisms on surfaces but does not necessarily kill all spores, unlike sterilization. A patient's label reads, "Take 1 tab PO-BID for 7 days." How many tablets will be dispensed? A. 7. B. 14. C. 21. D. 28. Answer B. BID means twice a day. 2 doses/day times 7 days equals 14 tablets. What is the brand name for clopidogrel? A. Lipitor. B. Zocor. C. Coumadin. D. Plavix. Answer D. Clopidogrel is marketed under the brand name Plavix and is used as an antiplatelet agent to prevent strokes and heart attacks. Which type of drug recall is most serious, indicating a risk of serious health effects or death? A. Class 3. B. Class 1. C. Class 2. D. Class 4. Answer B. A Class 1 recall is the most serious and is issued when a product could cause serious health problems or death. A technician must compound a sterile preparation. Which chapter of the USP should guide their procedure? A. Less than 797. B. Less than 800. C. Less than 795. D. Less than 705. Answer A. USP less than 797 provides standards for compounding sterile preparations to ensure safety and prevent contamination.